that this slight loosening of restrictions is a direct result of more people adhering to the order, practicing the 3 Ws, and the ongoing messaging of the Count on Me CLT public service campaign. As part of Phase 2.5, the county, the city of Charlotte, and all the 6 towns will move to the governor's order regarding alcohol sales restrictions. It continues to cease alcohol sales at 11 p.m., but does permit food to be continue to be served, and allows patrons to sit and eat at the bar area, assuming there is proper social distancing. Again, this is where we need to continue complying, and this is extremely important. Also with Phase 2.5, the county will begin easing restrictions at our parks. Playground facilities will be reopened. It may take a week before all playgrounds are accessible to the public, so I ask that you please be patient. As of now, the only fitness facility that will reopen is the one at the Aquatic Center and will reopen by appointment only. Since the mass gathering limits have increased, we are exploring how to begin reopening our indoor and outdoor pavilions. Earlier this week, the Board of County Commissioners passed several proposals to directly help businesses impacted by COVID-19, and I want to highlight one of those. I'm pleased to announce that beginning Monday, September 14th, Mecklenburg County will begin accepting applications for the Meck County Cares Small Business Relief Grant Program. The program will provide grants up to $25,000 per business located in any of the 6 towns or the unincorporated portions of Mecklenburg County. The program will be supported by $1.25 million in federal CARES funding. I want to encourage small business owners in the 6 towns and the unincorporated areas to visit mecknc.gov to learn more about the program and how to apply. The first meeting of the COVID-19 Recovery and Renewal Task Force took place Wednesday afternoon. The Board of County Commissioners created this task force in June, and there are 23 members. Over the course of the next year, it is their charter to develop plans and actions to help us emerge from the pandemic stronger and more resilient. Despite the loosening of restrictions, we still have community spread in Mecklenburg County, and we cannot slow down our efforts to let our guard down and relax. With the Labor Day weekend upon us, we must continue complying with the 3 Ws. Wear a face covering over your nose and mouth, wash your hands, and wait 6 feet. Earlier this summer, after both the Memorial and 4th of July holidays, we saw significant spikes in the number of positive cases, which took weeks to recover from. Our hospital partners are strongly recommending that people take all precautions this weekend. To help make the case for not letting down our guard this weekend, I would like to bring up Dr. David Calloway from Atrium Health. He has been crucial in helping lead our 2 million mask giveaway in Mecklenburg County. We are almost up to 1.25 million masks being handed out to date, but we still have a ways to go. Dr. Calloway will tell you firsthand what he has seen in the emergency room. Patients who never thought they would get COVID-19 ending up in the ER very sick. It's no joke, and everybody needs to be safe. And with that, I will turn it over to Dr. Calloway.
Thanks, Dina. My name is Dave Calloway. I'm an emergency medicine physician at Atrium Health. 10 weeks ago, June, we were on the news nationally. We were a hot spot with coronavirus. We had rates about 13%, and we were being looked at around the country as one of these areas that were critical in their infections. And with the governor's mandate, great partnership between the county, Atrium Health, our business communities, and our nonprofit sectors, we were able to get 1.2 million masks into people's hands. And this has dramatically helped to decrease COVID in our community. But more importantly, our community members took it upon themselves to get those masks on their faces. So the community members and our businesses and health systems coming together have helped get COVID under control. And we've been winning for a while, but we haven't won. I just got off a 10-hour shift in the emergency department last night, and I will tell you that we are not out of the woods yet. We are seeing people who are very sick with COVID. I saw patients last night who were in their 20s who had COVID in July or August, had recovered, but were still having trouble breathing because of the scarring in their lungs. This is not a joke. It is important that we do the simple things and we do it right. I get it. It's a pain to wear a mask sometimes. I have a 5- and a 7-year-old daughter. Putting them in masks everywhere we go, around all of our friends, can be inconvenient. But I'll also tell you that putting this thing on every single night breathing through it for 8 hours, our nurses and our techs, doctors wearing this so they can take care of patients, having their skin break down on their noses, around their ears, that's inconvenient as well. It's painful, but it's what we do to take care of patients. And what we're asking is that you do something simple. Just wear a mask like this. If you're around other people, if you can't space yourself out by 6 feet, do the right thing and be smart about it. You can do it for yourself, you can do it for your community, and that's the only way we're going to get out of this. The weekend is coming up. People are going to want to go out and have fun. By all means, do it. But do it smartly. Wear a mask, physically distance, wash your hands, and look out for each other. It's about you, it's about your friends, it's about your community. I'm going to stop, and I just want to say thank you again to the county for working with Atrium, the entire business community, our sports community, all of our nonprofits, and all of our citizens in Mecklenburg who have stepped up, put on a mask, and advocated for this to help us get through this pandemic. Thanks, Dina.
At this time, I'm going to ask Deputy Chief Jeff Estes to come up and talk about the enforcement strategies for this long weekend. Thank you.
Thank you. As we enter into this next phase, I am cautiously optimistic about the community and businesses' response going into the weekend. As such, we will be out enforcing both the general parameters of the governor's order, by which we are directed to do so, also the alcohol prohibition after 11. We do feel like the new guidelines in the order make that a lot clearer as to who can be open and who should not be open. And then we will also make sure that we have a good stance on our lakes to ensure that people are adhering to their social distancing requirements and not having large mass gatherings at sandbars, et cetera. Our folks and friends at the Coast Guard and Wildlife's office, along with our local law enforcement partners, will be on hand to ensure that takes place. The last message that I'd like to leave with you is that if you're out and about and you see a large party or a gathering that you believe exceeds the numbers listed out in the governor's order, that you would call 911, or if it's one that doesn't require an immediate response, 311, to let us know about these large parties and gatherings that are going on so that we can come out, make an assessment, and ensure people are following the guidelines of the orders. As we've enumerated time and time again, it is important that as a community, both from a citizen's perspective and a business perspective, that we take this seriously. We wear a mask when we're supposed to. We stay socially distant when we can, and we adhere to the mass gathering limits so that we can all get back to a sort of a new normal, as it were. So we look forward to the cooperation from the citizens over the long weekend. And we'd like to assure you that CPD will be out with our partners ensuring that the order is followed. Now I'd like to introduce Gibby Harris, our Public Health Director. Thank you.
Thank you, Chief Estes. Good morning, everyone. We have a case count today of 26,118 individuals in Mecklenburg County who have been infected by the COVID virus. I'm glad to say that that's stabilized recently. We're averaging about 115 to 120 cases a day, which is down from where we've been for a number of months. We've had 310 deaths. We've got 30 long-term care facilities in outbreak status and 3 child care settings and schools in cluster status at this point in time. Our positivity rate has stabilized. As you know, we've come down significantly over the last month, but we are stabilized around 6.7% over the past week. Our hospitalizations are stable. Our hospitals have sufficient beds, acute beds and ICU beds. About 5% of all cases are being hospitalized at this point in time. We have seen an increase in the number of younger adults testing positive over the past several weeks, and we need to watch that trend. Our testing is down as well. We've talked about this some before. Not as many individuals are coming in for testing, but we're still averaging about 3,100 of tests per day in Mecklenburg County. I have a couple of issues that I wanted to address. One is the issue of potential scams around contact tracing. I want to reemphasize how important it is for people to share their information with public health, but it's also important that they're comfortable that they're sharing it with the appropriate individuals. We will be calling you from a county-issued phone with either a 704 or 980 zip code. Not zip code, excuse me, area code. You may receive a text from us from a specific number, which can be verified on our website. We do know that the state DHHS department has been working on developing additional technology, which would mean that potentially some text messages would be coming from a state number, but at this point, that technology has not been implemented. So remember, we will ask you to confirm basic identifying information, your name, your date of birth, your address. We want to make sure that we're talking to the right person when we're providing information and asking questions. We will never ask for financial information or Social Security numbers. If you'd like to confirm the validity of the call, all you have to do is ask the individual for their name and then call our hotline number at 980-314-9400 to confirm that it is actually a call from the health department. Again, I want to reemphasize the importance of sharing information with us. That is how we're going to help keep the spread of this virus at a minimum. But again, want you to be safe with your information. We continue to see outbreaks in our long-term care facilities, but I do want to mention a couple of different things that have happened recently and guidance from both the federal as well as the state government. Nursing homes right now are being asked to test their staff based on the positivity rate in the specific county. Based on our positivity rate, staff are being asked to test weekly if they're not in outbreak status. If they're in outbreak status, they are being tested more frequently, as well as the residents being tested more frequently. In addition to that, the North Carolina Department of Health and Human Services has issued new guidance allowing for outdoor visitation by family members at nursing homes that are not in outbreak status. There are specific guidelines, very strict guidelines on how this can happen, but it is a movement in the right direction to help our families reconnect with their loved ones that are in these facilities. We continue to work with these facilities to make sure that they're implementing this guidance correctly. Regarding testing, we want to reinforce that we have not changed our testing guidance in Mecklenburg County. There have been lots of discussions at the federal level. CDC's guidance has changed a little bit, but continuing to have community spread in Mecklenburg County, we need individuals to continue to be tested if they need to be tested. If you have been exposed or potentially exposed to someone who is COVID positive or is having symptoms, we recommend that you continue to be tested, regardless of what you're hearing from other places. Also, the turnaround times on our testing has come down for test results. We're seeing most test results coming back within at least 48 to 72 hours, which is good. And we continue to ask you to follow the isolation and quarantine recommendations that you're receiving from the health department. Again, this is one of the things that will really help us reduce the spread in our county. We're working with our school systems to help them return to some level of in-person instruction. You'll hear more from the school system over the next couple of weeks about that. This continues to be a major priority for us, and we'll continue to work with them closely on looking at how to prevent spread once the schools open back up again. I want to reinforce the fact that even though our children are not in school right now, the requirements around school immunizations have not changed. So we are working to try to get our children updated. We've seen quite a few who do not have up-to-date immunizations because many clinics have been closed. but we are working with them to try to get all of our children appropriately immunized by the end of October. We do have a Saturday clinic this Saturday, next Saturday, 9/12, at the Billingsley Road location. It's by appointment only. You can call the health department to make an appointment. And I'd be remiss if I did not mention that flu shots are beginning to be available. The recommendation from the federal level is that everybody be vaccinated by Halloween. So you have 2 months to get your flu shot. Please do that. Our COVID ambassadors are being trained this week and next week, and we expect them to be in the field next week working with different organizations, our businesses, our restaurants, to make sure that they understand how to comply with the orders that are out there, but also providing educational information and working with their employees to make sure that they understand what they need to do. Everything that I've talked about is related to behaviors, and we know how difficult it is to change behaviors. We are moving into a holiday weekend in a situation where our state government has opened up some different facilities and different businesses. We want to make sure that people understand that if we're continuing to see our numbers move in the right direction, it is going to be dependent on us making sure that our behaviors do not put us at risk. Although we're opening more things up in our community, every time you go somewhere, you need to weigh the risk to you and to your family and to the others around you to make sure that you are not unnecessarily exposing yourself to COVID-19. We all want to make sure that these numbers continue to move in the right direction, because that's what's going to allow us to keep things open and to make sure that we're able to open more things like our schools. So we want to reemphasize the 3 W's: wearing your mask appropriately over your mouth and your nose at all times when you cannot socially distance and are out of your home, making sure that you're washing your hands often and washing them appropriately, as well as waiting 6 feet. I'd sort of like to add 2 more W's to the list. One is weighing the risks, and I mentioned that earlier, making sure that you're aware of your surroundings and that you're not putting yourself at unnecessary risk. And the last is watching out for gatherings. We know that's where a lot of COVID is spreading these days. You can gather appropriately based on the governor's restrictions, but make sure that you're continuing to wear your mask and that you're socially distancing. That will put you and others at less risk and make sure that our numbers are continuing to trend in the appropriate direction. We will open for questions now.
Thanks, Liam, for calling on me. This is Brent Jensen with WB2 Radio. Gibby, I'm curious. I had a chance to speak with David Tepper on Wednesday, and he was clearly not excited with the fact that you guys, whether it's you and or the state, were not going to allow fans. He cited how every team in the division was going to allow fans, and he thought that they could do it extremely safe, put down the guidelines and allowing only 12,000 people in a 75,000 outdoor seat arena. How much input did you and the county have in on that? And if you did, what were your thoughts?
We've had multiple conversations with the Panthers about their plans, and I will reemphasize that the plans that they've written are very solid plans and could really be beneficial when we're at a point where we're ready to have those types of gatherings in our community. Unfortunately, we're not there at this point. The decision about fans in stadiums was made at the state level. We worked closely with the state to review the plans and to have conversations about this. Again, this comes back to priorities in our community and where we need to be focusing. The other concerns that we had about the stadium is they may be able to somewhat control exposure within the stadium. They cannot control what happens before people come into the stadium and when they come out of the stadium. So there are many things to consider here. And based on the state's decision, we're supportive of the fact that we are not having spectators in the stadium at this point.
Gibby, it's Allison Kuznets from the Charlotte Observer. It looks like our daily average of cases is starting to tick back up in the last few weeks, that we have been adding about 130 cases. Now we're adding about 160 cases. What do you attribute to that uptick in numbers? And if you're seeing maybe some of these gatherings are leading to clusters in the community, if you could speak to that.
So one of the things that we know contributed to the uptick in daily numbers was a glitch that happened in reporting of cases from LabCorp to the state. There were a number of cases that occurred, positive test results from the early part of August that didn't get reported until late August, and those fed into our numbers at that point. So we know that that was part of it. The other part of it, I believe, is continuing to see opportunity for people to gather in the community and not necessarily wearing their masks and socially distancing. So again, our ability to keep these numbers moving in the right direction depend on people changing that behavior and doing the things that we know are going to help. We do not have other options available to us right now. We don't have a vaccine, and we're not sure exactly when that's going to be available. So people just need to continue not to put themselves at risk and others at risk. Any other questions?
Yes. Hi, Gibby. This is Robin with Fox 46. You guys had mentioned that some of the park facilities or the playgrounds would not necessarily, it may take a week or so to open those up. Can you explain that, the delay, and also what kinds of cleaning you guys are doing in regards to that?
Sure. I mean, the delay is just being able to deploy staff throughout the county to all the places where we have playgrounds. We have them in all over the county, so it's just a matter of being able to go out there, making sure they're cleaned and disinfected before they're accessible to the public. So we're getting started, but again, it just may take a little time for all those to become accessible. Next question, please.
Hi, Caroline Hicks with WBTV. Also, in regard to the playgrounds, basketball courts, I know a lot of those, like basketball hoops are tied up and some of the swings are tied up. So is that something you guys are going to start on today? And are you going to be monitoring parks to make sure that they aren't getting too crowded over the weekend?
Yeah, we're still waiting for some additional direction from the state on what we're calling contact sports. There was some information that was not included in their guidance, and so we're waiting to see what kind of guidance we get around contact sports. Includes things like basketball, volleyball, soccer, so we'll hopefully get that sometime later today, and we'll be able to provide some more information to the public.
This is Brett Jensen again. I'm curious, in terms of the nursing homes, as we see it getting better in the community and the percentages going down, we still seem to have a high outbreak number for nursing homes. Are nursing homes actually getting better? Are they status quo like they were back in April and May? What's the situation with nursing homes?
Nursing homes will continue to be a challenge, and part of that, there are a number of different reasons for that. One is it's congregate living, and we know how infectious COVID-19 is. So once it's introduced into those settings, you can see spread fairly quickly. The other issue we have is that the staff that work in these facilities come from the community, and we continue to have community spread. So that's the reason for testing them frequently, to make sure that they're not introducing it into our nursing homes. We have had good success working with our nurses. They really don't want this in their facilities, and they're working hard with us to make sure they're doing everything they can to reduce the amount of infection and to get out of outbreak status as quickly as possible. And what we see, I mean, we're giving you numbers, so I say 30 this week. That isn't the same 30 from last week. It's a constant rolling number. We have facilities that are coming in and out of outbreak status. So again, one of the challenges that we're going to continue to have as long as we have community spread is as staff come in and out of these facilities, the possibility that they will continue to see outbreaks.
We had Allison again from the Observer. It looks like Mecklenburg has missed its testing goal now for the past 2 months by tens of thousands of tests. Could you talk about why you're seeing less demand for testing, and also what Mecklenburg County's strategy is moving forward to make sure that folks are getting tested, and what information gaps we may have if fewer people are getting tested and we know less about who is transmitting and contracting the disease?
So the amount of testing available in our community continues to go up. We've recently worked with the state on a contract with a local entity that's going to be starting some mobile testing over the next couple of weeks to expand into different parts of the county. The other is we've got another private entity that has come in to provide some additional testing. So we know that testing is available. The reasons why people aren't accessing testing, what we have is anecdotal information. There are people who don't want to know that they're positive because we're going to tell them that they have to isolate and quarantine. That's truly unfortunate, because that is one of the things that's going to help us reduce the spread of this virus. I know how incredibly unfortunate it is, and we're working with the state to look at supports that we can put around those individuals who are needing to isolate and quarantine to make it more doable for them, so that they're not having challenges with work, or that they have access to food, or whatever their needs might be. So again, trying to make it more accessible to individuals and acceptable to them to get tested. So all we can do at this point is recommend and really encourage people to be tested if they have symptoms or have been exposed to anyone in the community.
Gibby, it's Robin again with Fox 46. I know you said that we should be hearing more from the school district in the coming weeks on reopening plans. Do you think that it's feasible for CMS to begin in the phases reopening, say, by early October?
Well, I'm not going to second guess the school system on a potential opening date. We are working with them to look at both community metrics as well as metrics within the system about when it's feasible for them to open, whether they do it in a phased approach or how best to do that. So we're working with them on a weekly basis to try to figure out the best way to do this, but the decision is going to be the school board's decision.
Gibby, to piggyback off of Robin real quick, I'm curious, we know that, or at least everything that we've seen or been told is that the younger kids, like elementary school age, are less susceptible to the symptoms than older kids. With that in mind, should colleges just go ahead and shut everything down until they figure this out? Or meanwhile, because like you said, they are more susceptible to the symptoms, as we heard Dr. Calloway say, than say maybe, a 10-year-old.
That's difficult to say as well. I do think we're seeing many colleges looking at the potential for virtual learning for the most part, at least for some period of time during this first semester. Again, we're continuing to work with the universities and colleges in our area to determine how best to move forward. UNC Charlotte right now is virtual until October 1. We're having regular conversations with them as well about the feasibility of opening on that date. And we do have a couple of colleges open now with students that are managing well. So again, we've just got to continue to work through these things. There is no template, there is no magic number, magic time frame for these things. But again, a lot of that has to do with priorities in our community and what we need to be opening at any given time. One more question, please.
Hi, I'm Caroline Hicks with WBTV. We know that there are some businesses in our area that are continuing to operate even though they have gotten citations or warnings. We're also hearing that they're maybe getting some different guidance from ALE versus through MEC ABC. Is there any plans to kind of clarify that guidance or what to do when these businesses are ignoring the warnings?
I'm going to ask Deputy Chief Estes to answer that question.
Yeah, thank you. There's no confusion as far as between ABC, ALE, and CMPD. They work together on a weekly basis. There may be from time to time different interpretation in the past on the order, but I can assure you that that we're all on the same sheet of music as it pertains to the to the order and who should be open. Remember, we're really talking about the time period prior to 11. After 11, all bets are off. There's no on-site consumption of alcohol. So it really revolved around what was a bar versus a restaurant versus an eating establishment versus a lunch counter versus so there are many different determinations under the existing alcohol laws. And if you get about 6 or 8 hours and you want to just peruse through the different alcohol rules that the state has, I invite you to do that. So trying to navigate all that on top of a pandemic related to people's livelihoods is can be tricky from a legal perspective. We believe the new guidance cleans that up and basically just limits it to bars for on-site consumption. And we don't have anyone that ignores warnings. If we get warnings, then we escalate up to citations, and from there we go to the ABC Commission, and from there we escalate as they move up. Again, the whole idea is that to abide by the public health parameters to ensure that we don't have a continuation of the pandemic. That's the goal. I know it boils down to who is a restaurant versus who is a bar, but we really want to make sure people know that the idea is to limit the exposure of groups of people as much as we can. So we feel like we're on pretty good footing there. Thank you.
Stand by.